It is 9 minutes past 8. Now, an urgent public health alert has been issued after a deadly meningitis outbreak in Kent, with health workers across England urged to look out for signs of infection. The UK Health Security Agency issued the alert as a vaccination programme targeting around 5,000 students began at the university. Now, the Health Secretary, Wes Streeting, says the general risk to the broader population is low.
I hope that people are reassured that we're proactively managing it, that the antibiotic provision is there, we're standing up vaccination, and the general risk is low, even if the disease itself is extremely serious.
Well, these students at Teesside University told us their concerns about what's happening, with some considering going private for a vaccine.
I haven't been out as much. I'm also it's just me and my friends. These lot would just mostly come to uni and then go straight to work after.
I mean, I don't really share drinks anyway because everyone gets ill all the time, and it's especially at uni, like freshers flu. I mean, we're quite far away, but you could say that about COVID, and then that's gone everywhere.
And would you be looking to get the vaccine?
Yes, I would recommend it, considering the circumstances. It's getting a bit concerning.
My mum's saying about going private. On about that this morning, actually. Obviously, she's had a look and said that people are going private for it, so she would have a look.
Well, parents and young people across the country have rushed to try and get that meningitis B vaccine privately, as we've heard there. Let's speak now to Pete Horrocks, who's the chair of the community pharmacy Tees Valley. Morning, Pete.
Good morning, Amy. Nice to speak to you.
Nice to speak to you as well. It's good to have somebody who knows the stuff on this. So before we get started, OK, I know young children from 2015 have been offered the meningitis jab on the NHS. Now, the problem we have now is this strain involves meningitis B, and that's not included on that particular jab, is it?
It's not, no. So the meningitis B vaccine is part of the infant vaccination schedule and has been since around about 2015. So currently, protection from vaccine is probably only to children under the age of 10, unless they've received their vaccination privately.
So this meningitis B vaccine, you can get it, but you've got to pay for it. Is that right?
You can. There's a significant number of pharmacies offer this as one of their private services. However, though, because of the increased demand, supplies are very limited, and people looking to obtain it right now are probably going to struggle getting it.
I was going to say how much, because obviously this is all stemmed from that event in a club and the university in Kent. So up here, are you seeing a lot of people asking about it and inquiring?
There's certainly high demand on a daily basis. I'm taking a number of phone calls from concerned individuals or concerned parents looking to obtain that vaccination. And I guess the key thing we say is it currently is low risk for the northeast where we're based. And unless people have had contact, then they shouldn't be worrying too much. But absolutely, they should. Aware of the signs and symptoms, and particularly if they've had any contact with people in and around the Kent area.
Yeah. So when it comes to the vaccine, when you said that stocks are running low, does that mean that you can't get many up here because everything is focused on the Kent and the surrounding areas?
Yeah, I mean, I've checked with a number of the wholesalers this morning, and there's no stock available for us to buy if we were looking to purchase some additional stock. Obviously, these things take time, and there will be a response from the pharmaceutical manufacturers to increase their stocks, but it might be a few weeks before we're able to get that. And it is something that people should consider having because it is available and it does offer a level of protection.
Yeah, I mean, because it can happen at any point. I know we're hearing a lot about it at the minute because of this particular outbreak, but I mean, it can happen at any point. You could get meningitis at any point.
Yeah, and particularly young people are vulnerable. Particularly how they socialise, and this often spreads more significantly with younger people, and obviously the impact of it can be devastating. Our thoughts go out to the families currently affected in Kent.
Yeah, I mean, yeah, it's just horrific. It doesn't bear thinking about, does it? So when you mentioned there, just being about being aware, really, signs and symptoms, what are we looking out for?
Yeah, so it's things like a fever, a headache, vomiting, stiff neck, significant sleepiness or drowsiness, and the meningitis rash that we are often kind of prompt to look out for, that red rash that doesn't fade away when pressed. But significantly, it's around these symptoms becoming sudden and seriously worsening over a quick period of time. That's the key thing. And anybody who has any concern over these sorts of symptoms, and particularly may well have been in contact with anybody or in the area, needs to seek emergency medical attention very, very quickly, because it can deteriorate very, very quickly.
Well, Pete, thank you very much for your time this morning. We do appreciate it. He's brilliant. Pete Horrocks, who is the chair of Community Pharmacy Tees Valley, just keeping us up to date there. So as we mentioned, we've been chatting to students around Teesside University, a lot of them concerned about what's happening and considering going private for that vaccine. Of course, you do have to pay for it. I've heard talk of £200, £220 for these vaccines. But as we've heard Pete saying there, your chances of getting one in our part of the world at the minute, very, very slim. Because there's such high demand elsewhere in the country where this outbreak is. Anyway, we'll keep you posted on BBC Radio Tees.